biggest South Asian media group, Y Media.
Good morning, ladies and gentlemen, distinguished guests, and members of the press. Welcome to Peel Region, and welcome to Wellfort Community Health Services. On behalf of our board and our committed partners, it is with great pleasure and pride that I stand before you today as the Chief Executive Officer of Wellfort Community Health Services and a representative of a dynamic collaboration of partners committed to improving access to comprehensive, team-based primary care in this community. As you know, the Ontario government has made a significant investment of $110 million to connect up to 328,000 people to primary care teams, bringing the province one step closer to connecting everyone in Ontario to primary care. This marks a significant milestone in our journey towards providing exemplary services to our community, and our community is in need of this support. As we get started, allow me to reflect briefly on the journey that has brought us to this point. Wellfort Community Health Services, local partners, and the Central West Ontario Health Team have been long committed to the well-being of health in our community. As a leader in providing culturally appropriate care, our collective teams focus on removing barriers to care for equity-deserving populations and bringing care closer to home. Through dedication, perseverance, and the hard work of our talented healthcare professionals, including physicians, nurse practitioners, nurses, physiotherapists, social workers, health promoters, navigators, dental teams, and dietitians, among others, they have strived to ensure that quality care is accessible to all who walk through our doors and in this community overall. However, as we know, the landscape of healthcare is constantly evolving, presenting us with new challenges and opportunities. This demands our healthcare system continue to grow, and it's imperative that we adapt and innovate to meet these challenges head-on. That is why today's announcement is not just about funding, it is about investing in the future of healthcare in our community through new partnered approaches. Our visioned partnered neighborhood model of care will be advanced with new investments that include over 50 clinicians who will work together and create a more coordinated and connected care system with partners across 8 unique primary care practices, CMHA Peel Dufferin, and supported by comprehensive home and community care in this community. We have envisioned a model of seamless care for those who currently do not have access to primary care, while also offering an integrated approach of health providers who can best meet the unique needs of our community across our partnered setting. I am so thrilled to have so many distinguished dignitaries who have advocated hard for this new opportunity that brings care to this community. Without further ado, it is my honor and privilege to acknowledge Parliamentary Assistant Don Gallagher, who brings greetings on behalf of Minister Sophia Jones. Welcome.
Thank you. Good morning, everyone. And thank you very much, Kimberly, for that introduction. My name is Dawn Gallagher Murphy, and I am the Parliamentary Assistant to the Minister of Health, as well as the Member of Provincial Parliament for Newmarket Aurora. And I'm very happy to be here this morning with all of you. It's a pleasure to be here at Wellfort Community Health Services in Brampton, alongside my colleagues, Minister Williams, MPP McGregor, and I believe MPP Anon will be coming along. These are your local champions at Queen's Park. And I want to extend my gratitude to Wellfort for hosting us here this morning, to Kimberly Floyd for her leadership, and to all the healthcare professionals here at Wellfort for their unwavering commitment to provide exceptional care, ensuring healthier community where everyone belongs. I'd like to take a moment to recognize and express my appreciation to our dedicated healthcare professionals, advocates, and municipal leaders who are here today, who are definitely instrumental in ensuring that faster and more convenient care closer to home is accessible in this community. I also want to acknowledge Peel Homeless Health, specifically nurse practitioner Clinton Barreto, founder and executive director of HHP, as well as all the nurses and the nurse practitioners for their care to the most vulnerable patients, those experiencing homelessness. I did meet Clinton last year at Queen's Park on a lobby day for nurse practitioners, and I heard all about the great work that he's doing for this community. So I just want to say hats off to him and his team as well. I'd like to thank all of them for their tireless efforts in helping and improving the health and well-being of all Ontarians. As noted, as the Parliamentary Assistant to the Minister of Health, the Honourable Sylvia Jones, I am thrilled to join you today and congratulate you. And there's my colleague, MPP Anand. Please join us, Deepak. I am thrilled to join you today and congratulate you on this significant investment from our government. And as Kimberly noted, yes, this is our goal, is to have one step closer to ensuring that all Ontarians can be connected to a primary care provider. This past summer, I had the privilege of participating in several roundtables with primary health care providers across this great province of ours. There were a couple of recurring themes in these discussions. Firstly, primary care providers needing relief of some of the administrative burden that they were experiencing on a daily basis. Secondly, the need for more multidisciplinary teams to provide community care, that the team approach provides a holistic care model that put the patients at its center. And this is what Welfare is doing so well. When we launched Your Health Plan last year, the goal has been to connect Ontarians at every stage of life to more convenient care options. We have taken bold, innovative action to build a healthcare system that puts people at its heart, that puts all people at its heart. Now back to the primary care teams and the patient at its center. By adding these 2 new sites here at Wellfort, we are also part of 53 new and 25 expanded teams. And we are ensuring that communities right here in the Peel region get the care they need close to home. These teams consist of family doctors, nurse practitioners, registered and practical nurses, social workers, and more will help people currently without a family doctor connect to primary care. Here in Brampton, Bramalea, and Malton, we are announcing more than $4,032,000 in new funding that will allow for the expansion of a new Welfare CHS site and new homeless health Peel hub to connect approximately 8,800 people to primary care. Timely access. This is something Kimberly and I were just talking about earlier. Timely access to primary care makes a difference. It helps people stay healthier longer and with faster diagnosis and treatment, as well as consistent support managing their day-to-day health needs, thereby alleviating strain on emergency departments and walk-in clinics. We're not going to stop until everyone that wants to have a primary care provider can connect to one. Together with historic investments to expand medical seats, including here in Brampton, or Bramalea. We're Bramalea, but it's going to be in Brampton. And breaking down barriers so highly skilled, internationally trained doctors can care for people in Ontario. The Ministry of Health modeling shows that these initiatives will help connect a near 98% of people in Ontario to primary care in the next several years. So thank you to Associate Minister Williams for inviting me here today for this amazing announcement. Thank you to Wellford Community Health Services and Peel Homeless Health Hub for all your hard work and dedication in providing high-quality connected care to the great people of Brampton and Bramalea and the entire Peel region. Thank you.
I'm chuckling because I've been in Brampton my whole life since 1980, and I've always known this area as Bramalea. In my heart, it's Bramalea. But yes, we're all in Brampton here. No, we're not going to go back there. But it's such a great announcement this morning, and it's an honor to be here with my colleagues, MPP Graham McGregor, MPP Deepak Anand for Malton, as well as the regional councillor Pat Fortini for this area, Ward 7 and 8. My former colleague, because we used to serve on Brampton City Council together, and also Councillor Fonseca, regional councillor. Thank you so much for being here. Kimberly, I'm just excited every time I come into this space because I know how much work you all are doing, and it's making such an impact in the community. And your steadfast dedication to delivering preventative initiatives and primary healthcare services while empowering our communities is so truly commendable. And I know that for Wellford, particularly here, the over 2.6 million that you will be using and spending to keep our communities healthy is going to really have a significant impact. I'd like to take a moment to recognize the invaluable contributions of the members of Wellford family, including the Bramalea Community Health Center for Diabetes Education Program, the Bloom Clinic, Health and Smiles, and Four Corners Healthcare Center. Your tireless work has undoubtedly made a significant impact on the lives of many. And further to these remarkable initiatives, the recent investment of the $110 million demonstrates our government's commitment to ensuring that every Ontarian who wants a primary care provider can connect to one. And this funding will directly benefit over 328,000 individuals and linking them to primary care, as PA Gallagher Murphy just mentioned. You know, I just want to also thank PA Gallagher Murphy for your work and your warm and genuine desire to see people healthy. And you and your parliamentary assistant colleague Robert Martin, you know, with Sylvia Jones, all three of you are really making an impact and advocating for the right things. It was an honor to be with you all together when we announced mammograms for women age 40 and lowering that age. What an impact that is going to make on the lives of women. You know, and as the Minister for Women's Social and Economic Opportunities, the initiatives that you all are taking and looking at, that we're advocating for, is going to see so many women healthy. And when we look at communities like Brampton and Bramalea, like Brampton, you know, I always say women are the heart of the family and the communities, and they need to be healthy and also cared for in centers that are culturally sensitive. We are a diverse city in the city of Brampton. And so I'm just always thrilled when we're really speaking to the needs of families and the needs of women, because your health is everything. So, you know, I just want to, while organizations like Wellford highlight the significance of healthcare accessibility, you're ensuring that Ontario residents, regardless of their situation, can access healthcare promptly. And so I just want to thank you all for being here today. This is an amazing announcement and a step in the right direction as we continue to build our healthcare system for the next generation. And so now I'm going to turn it over to the Regional Councillor Fonseca, who is the Chair of Health Systems Integration Committee, for further remarks. Thank you so much.
Well, good morning, everyone. Is this not just the most amazing announcement?
Yes.
So first, I would like to say a huge thank you on behalf of myself as Chair for Health Systems Integration at the Region of Peel, and also representing our Chair, Nando Yainika, today. And it's amazing to have with me here today my council colleague, who I also happen to sit beside, and we have many chats offline about the importance of health systems integration. A huge thank you to the Minister of Women's Social and Economic Opportunity of Ontario, Charmaine Williams, Parliamentary Assistant to Minister of Health, Dawn Gallagher Murphy, and Kimberly Floyd, CEO of Welford Community Health Services, for this incredible announcement today, and also to be here with MPP McGregor and MPP Anand, who I see tirelessly out in the community, not only as Chair of Health Systems Integration for the Region of Peel, but out at various announcements out in the community, both in Brampton and yes, in Mississauga, and in Caledon, where they are tireless champions for the community and health systems integration. And being here and having this announcement made at Welford, it is a shining example to Welford as to how, when we all work together, when it comes to integrated health and housing services, the importance of, when we're all working together, the importance of how the outcomes are better for everyone in the community. Peel Region is facing an affordability housing crisis and a health crisis, and we are seeing more and more residents from all walks of life struggling to live affordably, and too many residents are experiencing homelessness. We estimate that there are 91,000 households in Peel experiencing core housing and health needs. It is no secret how closely intertwined stable housing and good health care are. And while it may seem like a distant memory, COVID-19 was not only a test for all of us and our communities, but it also exposed gaps in inequities in our healthcare system and in our housing models. Recognizing that people live precariously are also likely to face complex health challenges, Peel Region has launched an innovative co-design process to develop an integrated, community-based healthcare model for people experiencing homelessness. And while this work has been underway for quite some time, Peel has been able to establish an interim model of care and was the sole funder for contracts with Homeless Health Peel and the Salvation Army. And this interim model included opening the Dundas shelter as a medical shelter where homeless clients could receive and continue to receive high-quality, trauma-informed, patient-centered primary care. Since the shelter's opening in June 2022 until December of 2023, 428 patients have received services for complex health needs related to, yes, in the beginning, COVID-19 complex needs, but now transitioning to other complex healthcare needs. Peel has also been funding Homeless Health Peel to provide a community nursing program that provides nurse-led care in emergency shelters and community drop-ins. Today's provincial investment and announcement of $1.7 million and also PA Gallagher Murphy, you also announced, was it $8 million?
It's a total between Homeless Health Peel and Welfare. It's a total of over $4,032,000.
Okay, big round of applause again. So the 1.7 million and this total of 4 million will not only allow us to operate this successful health model, but it will also give us the opportunity to expand and enhance its reach. On behalf of the Region of Peel and Peel Council, I want to extend my appreciation to the Ontario government, to Welfare Community Health Services, the board, all of the volunteers, all of the community organizations that are connected not only to Welfare Community Health Services, but organizations, services like Welfare throughout our Region of Peel for recognizing this important work and helping more residents get and keep the healthcare and housing needs that they not only need, but also deserve to make sure that they can live more resilient lives, healthier lives, long into the future. Thank you very much. Now, I'm not sure if I'm passing the mic back to, I believe I'm passing it back to Kimberly.
Thank you, Councillor Fonseca. Wow, what a day. This is a very exciting investment announcement, and I truly thank all of our dignitaries who've taken the time to be with us today, but also your advocacy every single day for this community. We will take the torch, we will take the responsibility, and we will make a difference in this community. On behalf of my colleague, Clinton Barreto, the founder and executive director of Homeless Health Peel, he is a passionate leader and clinician who today couldn't be with us because he's in the field working with patients who need his care. Wow. He asked me, though, to bring greetings from him. The Clinton and the team at Homeless Health Peel represent an experienced and passionate group of healthcare heroes who are grateful for the acknowledgement of the important work they deliver every day and have been delivering for the past 3 years. This investment is a symbol of the continued commitment by provincial and regional levels of government that all members in this community will be served and cared for, and access to comprehensive health care is possible for all. With this collective substantial funding, our community health center, our partners, Homeless Health Peel, will be able to together expand primary care teams, team-based care. We will enhance our healthcare infrastructure and implement innovative programs tailored to the unique needs of this community, while also focusing on improving the healthcare experience of our treasured healthcare professionals. This funding announced today represents more than just the financial support. It is a vote of confidence from the province in our mission and vision together that we've created to commit to this community. It's a testament to the hard work and dedication of our collective staff and partners who go above and beyond each day to ensure the well-being of this community. And most importantly, it is a commitment to ensure that every member of our communities will have access to healthcare services they need and deserve. This vision that we put together has been set by our collaborative spirit and is possible by the visionary partners, many of whom are here today. I want to take a brief moment to thank our colleagues from our primary care partnerships, Dr. Jeff Ashley, Dr. Priya Suppel, Dr. Anastasia Progowski, Anthony Di Valentino from the Central Brampton Family Health Team, Queen Square Family Health Team, Anne-Marie Lang-Berkowitz from the North Peel Family Health Team, David Smith from CMHA Peel Dufferin, Nancy Saxton and Aruna Mitra from Home and Community Care Support Services Central West, Rishika Thakur Malai from Central West OHT, and Sarah Hobbs from the Alliance for Healthier Communities. Many other supporters will assist us to ensure that this investment is used to impact the community the way it is intended. This investment will empower us, will charge us forward, and make sure we provide comprehensive, coordinated, and connected person-centered care that not only addresses the immediate healthcare needs, but also promotes long-term health and wellness across this community. We're going to strive toward a future where every individual has access to the quality healthcare delivered in a more connected and coordinated way. We offer this heartfelt thank you for this investment and for celebrating with us today. Thank you, everyone, for being here.
Hi, my name is Dawn Gallagher Murphy, and I'm the Member of Provincial Parliament for Newmarket Aurora, as well as the Parliamentary Assistant to the Minister of Health, Sylvia Jones. And I'm so thrilled to be here today in Bramalea in Peel Region because we had a great announcement today, and that is over $4 million will be coming to this area to create more primary care teams. Why is that so important? Because we are going to be connecting more than 8,800 people to primary care. This is all part of our government strategy to ensure that anyone who would like to connect with primary care can get that service. And it is a historic investment of $110 million that will help more than 328,000 people across this province connect to that primary care. I'd like to thank my colleagues, the Minister, Associate Minister of Women's Economic Development, Charmaine Williams, for her advocacy, as well as MPP Graham McGregor for his advocacy, and of course my good friend MPP Deepak Anand, because he is an amazing champion at Queen's Park for his constituents, and I appreciate his advocacy to ensure this funding came to Peel Region to help his constituents as well connect to primary care. Thank you.
Hi everyone, I'm Charmaine Williams, MPP for Brampton Centre and the Minister for Women's Social and Economic Opportunities for the Government of Ontario. Well, today is an exciting day because under the leadership of Premier Ford, we have announced over $4 million to the Wellfort Community Health Centre. This funding is going to go so very far because we are making sure here at Wellfort that there are doctors, there are nurses, there are healthcare practitioners that are making sure that you have the healthcare you deserve. And this investment is also going towards the homeless hub, which is also going to make sure that people who are homeless do have supports and healthcare supports that they deserve. You know, this is a part of Ontario's announcement of over $110 million that are going to be going to expand community health services. That means over 328,000 people are going to be getting access to health care that they truly, truly deserve. I want to thank PA Parliamentary Assistant Dawn Gallagher Murphy for coming here today with my colleagues, MPP Graham McGregor and MPP Deepak Anand, to make this announcement here in Brampton. I've been here a very long time, since 1980, and I love this community, and I just want to make sure that all of you have the connection to healthcare services, everything that you need to make sure Brampton is the best place to live, work, and play. Thanks so much.
Sat Sri Akal, Namaskar, Assalamu Alaikum. Medwarda, Brampton North PC Party MLA Graham McGregor here at a very exciting announcement at Wellfort Community Services, Health Services. Great work by Charmaine Williams, our local MPP and the Minister of Women's Social and Economic Opportunity, and Dawn Gallagher Murphy, who's a PA to the Minister of Health. This kind of investment in the community is going to set up a hub with multiple primary care practices, which is going to expand healthcare coverage for almost 10,000 Brampton, Bramalea, Malton residents. So it's very exciting news. It's part of our plan to make sure that anybody who wants a primary care practitioner has that access in Ontario. We're going to keep getting it done for the residents on healthcare. Let's keep it going.
मेरा नाम दीपक आनंद है जी, मैं मैंबर ऑफ प्रोविंशियल पार्लीमेंट मिसिसागा माल्टन तो बहुत अच्छा लग रहा हैगा कि जिवें कि ਆਪਾਂ ਨੂੰ ਪਤਾ ਹੈ ਮਾਲਟਨ ਦੀ ਗੱਲ ਕਰੀਏ ਜਾਂ ਫਿਰ ਬ੍ਰੈਂਪਟਨ ਦੀ ਗੱਲ ਕਰੀਏ ਹੈਲਥ ਕੇਅਰ ਨੀਡਸ ਦੀ ਵਿੱਚ ਜ਼ਰੂਰਤ ਹੈਗੀ ਹੈ ਤੇ ਉਸ ਜ਼ਰੂਰਤ ਨੂੰ ਪੂਰਨ ਕਰਨ ਵਾਸਤੇ ਜਿਹੜੇ ਸਾਡੇ ਮਿਨਿਸਟਰੀ ਆਫ ਹੈਲਥ ਦੇ ਪੀਏ ਨੇ ਉਹਨਾਂ ਨੇ ਜਿਹੜੀ ਇੱਥੇ ਫੰਡਿੰਗ ਹੈਗੀ ਹੈ ਅਨਾਉਂਸ ਕੀਤੀ ਹੈਗੀ ਹੈ ਵੈਲਫੋਰਟ ਨੂੰ $4.3 ਮਿਲੀਅਨ ਜਿਹਦੇ ਨਾਲ ਕਿ 9,000 ਦੇ ਕਰੀਬ ਲੋਕਾਂ ਨੂੰ ਪ੍ਰਾਇਮਰੀ ਹੈਲਥ ਕੇਅਰ ਦੀ ਐਕਸੈਸ ਮਿਲੇਗੀ ਔਰ ਮੈਂ ਧੰਨਵਾਦੀ ਹੈਗਾ ਵਾਂ ਕਮਿਊਨਿਟੀ ਦਾ ਫॉर ਆਲਵੇਜ਼ ਕਮਿੰਗ ਟੁਗੇਦਰ ਐਂਡ ਰੇਜ਼ਿੰਗ देयर ਵੌਇਸ ਆਪਣੇ ਜਿਹੜੇ ਇਸ਼ੂਜ਼ ਨੇ ਉਹ ਰੇਜ਼ ਕਰਕੇ ਆਪਣੇ ਲੋਕਲ ਅਫੀਸ਼ੀਅਲਸ ਨੂੰ ਲੋਕਲ ਇਲੈਕਟਿਡ ਜਿਹੜੇ ਮੈਂਬਰਸ ਨੇ ਉਹਨਾਂ ਨੂੰ ਦੱਸਦੇ ਨੇ ਤੇ ਧੰਨਵਾਦ ਹੈਗਾ ਸਾਡੇ ਮੀਡੀਆ ਪਾਰਟਨਰਸ ਦਾ, ਜਿਨ੍ਹਾਂ ਦੇ ਕਰਕੇ ਅਸੀਂ ਇਸੀ ਅਨਾਉਂਸਮੈਂਟਸ ਨੂੰ ਘਰ ਘਰ ਤੱਕ ਪਹੁੰਚਾ ਪਾਉਂਦੇ ਹੈਗੇ ਆ। ਸੋ ਦਿਸ ਇਜ਼ ਅਨਦਰ ਗ੍ਰੇਟ ਐਗਜ਼ਾਮਪਲ ਆਫ ਕਮਿੰਗ ਟੁਗੇਦਰ ਐਂਡ ਵਰਕਿੰਗ ਟੁਗੇਦਰ ਐਂਡ ਸੋਲਵਿੰਗ ਦ ਪ੍ਰੋਬਲਮਸ ਆਫ ਆਵਰ ਕਮਿਊਨਿਟੀ ਟੁਗੇਦਰ। ਧੰਨਵਾਦ।
The biggest South Asian media group, Y Media.